here's another picture. There, most commonly is where we see it around the neck. Is that where yours was, around the neck? See, look how big that lymph node is right there. And we've got some that are right here too.
Did that one rupture?
I'm sure that it probably did. That's actually not my picture. Yes, it probably had ruptured at one point and is about to do it again.
And if that ruptures and it releases, how long does that, is it virus thing?
It's a bacteria, and it takes it, if the animal is exposed to it and it gets in a break of skin, it takes about 2 to 6 months for it to develop in their body.
How long will it live in the environment?
It can live in the environment for a long time.
Okay.
So UV light, cauterizing, bleach, organophosphates, that kind of thing will help kind of take care of it. So.
If you have exposure at your farm, say it ruptured, what about cleanup or disinfecting the area?
You absolutely do that. Like,
I mean, what would you recommend?
I'd recommend, for example, Josh, who works at our clinic, he had a yearling ewe that he noticed had a little lump on there, and they lanced it at the farm, didn't think anything of it, and then they had 3 the next year that came up with it. And he ended up taking his panels, he flank torched those hog panels that he used bleach all over the place. He didn't keep anything in that stall for about 6 months, and he didn't have any problems. So absolutely, really disinfect. And like I said, I don't want to scare you. Most times it may be something as simple as just a simple abscess. But yes, be very clean with it. Bleach, like I said, organophosphates, that kind of thing will help kind of take care of it. So. Okay, listeria. Anybody seen cases of listeria with their goats? I see a lot of listeria. Listeria is a neurologic disease. Again, it's actually a bacteria. Listeria is bacteria that likes organic material, rotten hay and rotten feed and that sort of thing. It's also found in the soil. What happens is the goat tends to ingest this bacteria, and they bite the sides of their mouth all the time and abrade their mucosa, the lining inside their mouth. And that bacteria will travel in the oral cavity and go to nervous tissue. So what they'll do, they'll kind of walk around with their head tilted to the side. They may have a really high fever. They're unstable. They're very depressed. They don't want to eat. They're just not right. Something is wrong. But most times they have neurologic signs. We oftentimes can see abortions too. With listeria, since it's getting into the nervous system, sometimes the nervous system is not very forgiving. So you may kill and get rid of the bacteria with appropriate antibiotics and anti-inflammatories, but there may be damage to your nervous system, and sometimes those neurologic signs won't go away. So in saying that, we live in an area, there's high humidity, there's lots of hay, there's lots of moldy feed, and we're just as guilty as anybody at our place. But one thing to do is to not feed them moldy hay, rotten feed, that kind of thing. So that'll kind of take care of that. But antibiotics, steroids, anti-inflammatories, and supportive care are the best way to treat it. This is a nanny here that's very mentally depressed, and she's holding her head. Oftentimes they'll grind their teeth, or they can't move their mouth right, and that sort of thing.
Is the gut listeriosis out to circle?
Yes, they can circle too. Yes. Anything dealing with the central nervous system, they can do that too. Yes?
I think we had that once because ago we tried giving it vitamin B, but it didn't work, and it started walking in circles.
Yep, that could have been. And another neurologic sign, disease that I have written up here that I don't have up here that I should have talked about is polioencephalomalacia, and that is a thiamine deficiency, and that's when you give them vitamin B for that. So I didn't talk about that, but
like if you suspect, how would you determine that goat bear has?
Usually what we do is based off clinical signs. I kind of have a regime of a treatment that's kind of a shotgun. We always do anti-inflammatories. We always do antibiotics if they have a really high temp, okay? You could actually pull a blood sample and do a blood culture, but it's pretty expensive. So what we do is we treat them with thiamine because it could be polioencephalomalacia. We treat them with antibiotics. We treat them with anti-inflammatories and kind of hope for the best. So, okay. Respiratory disease. This is something you will probably battle with your goat project. I know we do with the sheep end of it. Respiratory disease, that's just good old-fashioned pneumonia. There's a multitude of factors that cause pneumonia. There's stress. It's leaving from that one farm you just purchased your wethers or your does from, and you're taking them to your house. It's something that's completely new and completely different. It's the change in the environment. It went from 75 degrees to 20 degrees like it has here recently. And there's lots of viruses and bacteria that are involved in the respiratory disease complex. Clinical signs, sometimes what they'll look like, they've increased their breathing. It's very rapid. They'll sneeze, they'll cough, they'll have a nasal discharge, and they'll run a fever. A lot of times they don't want to eat, they don't want to drink, and they're kind of standing to themselves. Treatment, more often than not, it's antibiotics. We give them anti-inflammatories and sometimes antihistamines. It all depends on what we think's going on, if it's viral or bacterial, and how we treat. But remember, viruses, there's not a magic drug to kill a virus. So just because you give antibiotics doesn't mean an animal may not get better. If it's a viral infection, it's not going to help. We're giving them antibiotics to cover for secondary bacterial infections that may happen. But respiratory disease is something we deal with.
Is it deadly?
It can be, absolutely it can be. Especially if we get nasty bacteria like Pasteurella and whatnot into their lungs, it absolutely can be deadly.
Would it be bad to be giving them an antibiotic thinking that they might need
No.
it, not be?
No, we usually do. But if they don't get better, so it's hard to determine, is it because the antibiotic's not working, or do we have a viral component on top of this? Because there's lots of antibiotics that we can choose from to use. Penicillins and LA200 don't work like they used to. So you have to go with something that's a lot stronger than that. And we may be actually killing a bacteria that's causing a problem, but usually there's a virus that's on top of that, so it's all supportive care after that. In terms of supportive care, yes. Anti-inflammatories make them feel better, reduce their temp, making sure they're eating, make sure they're hydrated, and that sort of thing. So prevention is a big key. So when you bring your goats home, don't put them in a 4x4 and there's no air circulating in there. That's a common problem we see. Make sure there's proper ventilation that's in there, meaning that, do you have a fan on them in the summertime? Can they get plenty of air? Is their pen clean? If their pen is dirty and full of ammonia where they've peed and pooped in there for days and days and days, that makes them more susceptible to getting respiratory infections. So make sure you clean their stalls. Appropriate shelter. Are they outside and they don't have a lean-to or a tree to get underneath? Are they getting rained on all the time? That's something to think of. And also proper animal density, meaning that in a 4x4 pen, do you have 10 of your show goats in there? Well, how are they all going to breathe and get along if there's too many in there? So that's something we get concerned about. And quarantine them. If I bring a new animal to my place, I don't just turn them in with my show flock or my show herd. I keep them in an area for at least 10 days so I can kind of watch them. If they're going to get sick, we talked about stress and change in their environment. They're going to within the first few days you bring them home. So don't keep them next to your nice and healthy ones you got there on your place. Put them in somewhere else to watch them for a few days. So if they get sick, they're not going to spread it to somebody else. Enterotoxemia, that's overeating. You guys heard of overeating disease? It's a clostridial disease, and what happens, it's not because they eat too much and they die. That's not the problem. However, it's usually the fattest, healthiest, and the one that's eating the most grain. What happens is they'll eat so much grain, it's a kind of a buffet in their intestine for this nasty clostridial, this bad bacteria. What happens, that bacteria, this is kind of related, if you guys heard of blackleg before, blackleg in cattle, it's in the same family, but it's in the intestine of sheep and goats. It's very, very nasty, bad disease. Usually what happens is they'll lose their appetite, they're very depressed, their abdomen can sometimes become distended because that bacteria produces toxins and their gut won't move after that. They can have diarrhea and fever, but most often they were fine yet last night. You come out there and they're deader than I don't know what. That's usually one thing you'll see. Kills them pretty quick. This guy is overeating.